Alrighty, it's working. All right, and I believe we are live now. We are live. Dr. Patrick Mahaney, how are you doing?
I'm great. Welcome. Greetings from sunny Southern California, West Hollywood to be more specific.
Perfect. Well, greetings from Austin, Texas, where I'm hanging out. We are getting folks to join in right now, so we're going to start off with just kind of a little bit of chat. You mentioned it was nice and sunny over there. I mean, I've been looking at the weather. I am quite jealous of what you all have been experiencing.
That's part of why I wanted to end up in Los Angeles, because I grew up mostly on the East Coast, and I was tired of trudging through this. When I lived in Washington, D.C., trudging from my apartment to the metro to get to my job, and all the snow and rain. I could deal with a little traffic and have nicer weather than to deal with oppressive freezing cold temperatures that affect the ability to go anywhere. So I've managed pretty well so far.
Oh, perfect. Well, I'm glad you made it out there. Looks like we've got a couple folks joining in. Folks, welcome. This is our webinar series. We're going to talk about dental disease in cats with Dr. Patrick Mahaney. I am Dr. Chris Menges from Basepaws. And, before we jump into everything, we have to say at the beginning of each one, this webinar is just a general education webinar about cats this one will be about cat health, and then of course about COVID. Now, this information is not to be used to treat any specific cases. If you do have any clinical questions or treatment changes for your cat, make sure you talk to your local veterinarian before implementing those changes to make sure that they're appropriate for your own cat's health. And now, while we are talking about lots of anything, always feel free to drop comments. We're on Facebook and YouTube. Just drop them in the comments. We'll be able to pull them up and answer these questions as we go along. All right. Comments.
Into the comment area. Comment down here. Comment here.
Here. And subscribe. Top right corner. We got all the buttons. Click all of the buttons that you can see on your screen that keep you on our screen, and we'll be good to go. All right. Well, Dr. Mahaney, thank you so much for your time, for coming back. I know you were with us with Cats and Coffee, talking a little bit about house call there. And so today,
and I was so inspired by Cats and Coffee that I had to have coffee again today. So,
oh, perfect. It is a little late for me for coffee. I get a little jittery, so I'm unfortunately I've already transitioned to water today. But we'll have to get you a Basepaws mug for all things.
Great, thank you.
Now, I know you were given a little bit of flack on Cats and Coffee for not having a pet with you.
The reason I don't currently have a pet is that I had a dog named Cardiff, who was a very special Welsh Terrier, and Cardiff had IMHA, which is immune-mediated hemolytic anemia, 4 times, and T-cell lymphoma twice. So after 12 years, most of which were kind of bouncing back and forth between fatal diseases, I need a little bit of a break. And I also spend 5 to 7 days a week in clients' homes with their dogs. And sometimes when my clients travel, my husband Phil and I take their dogs into our home and board them, or medically board. So we have dogs and sometimes cats coming in and out. But I do have a friend with me to represent the cats. I have my feisty pets, and even more perfect that we're talking about dental disease, because look at those chompers.
Ooh, those are some good chompers there. Look at them. And I think that's what most people are worried about when we talk about dental disease and getting in their cats' mouths, is seeing those chompers a little bit. But those are perfect for explaining how to teeth or how to look at those teeth. Do you have a name for your feisty pet?
I don't, but he kind of looks like Garfield, but a little different. So I'll have to come up with something. Maybe people can suggest a name for my feisty cat.
I mean, what about Scarfield? Scarfield, right?
I like Scarfield because it looks like these are scar-inducing. The worst trauma I get as a veterinarian is from cats. They just have so many ways to hurt you. And so the very first thing I do in my cat appointments is trim their nails.
You just decrease that level of stress for everyone involved. Perfect. Well, you mentioned that you started out in the Northeast. Why don't you give us a little bit of your background? How did you end up in the LA area?
Well, I've always wanted to live in Southern California. I mostly grew up in New Jersey. I went to University of Delaware for undergrad. I had an animal science degree and went right to veterinary school at University of Pennsylvania. I wanted to become a specialist in radiology, and so I matched for an internship in Washington, D.C. at Friendship Hospital for Animals in 1999. I've been in practice for over 20 years now. And my plan was to go right from my internship to the residency programs, but didn't get into residency programs. So I stayed in the DC area, did a little bit of corporate work, realized that wasn't quite the right fit for me and how I wanted to practice. Worked really nicely with emergency, except for the crazy hours. I didn't feel like staying up all night and having to sleep all day. I need to like function and self-care and take care of my own health. So I was big into, and still am big into, yoga. And I'd gone through 2 levels of teacher training. So when I did emergency, I had big chunks of time off where I could be a yoga teacher trainer on the side. And, I wanted to get out. I wanted to get out of DC post 9/11 because it became a very hostile place. I actually used to go to the Friendship Heights post office where people died from being exposed to anthrax. So I had to go to the doctor and get swabbed and go on ciprofloxacin prophylactically. So I'm like, the universe is telling me to get out of DC. So I moved to Seattle, where there's a really good yoga community. And liked it there, but didn't love it. Had an opportunity to buy a really nice home in the Olympia, Washington area, which is a very progressive area right at the bottom of Puget Sound, south of Seattle, and liked it there. But then like, wait, I'm stuck in the suburbs and I'm an urban guy, so this is odd. Had a relationship end. Had a friend from yoga teacher training who was living in Pasadena, right outside of LA. This is like a very one door open, another door closed. Relationship ends one day. Next day, my friend Kristen calls me and says, hey, I met this woman at the dog park. Her husband is a lawyer and he co-owns 2 veterinary practices, one in Pasadena, one in West Hollywood. They want to meet you. Click. Next call from the lawyer saying, hey, my wife met your friend at the dog park. We're interested in meeting you. Do you want to come down to interview? I was like, okay, yes. So I flew down early January, like New Year's 2005, 2006, signed a contract, moved to LA. 3 months later, I'm like, this is it. I'm going to make this work. I worked at a West Hollywood 24/7 practice for a while, and I was going through acupuncture training at the time, and I was trying to incorporate that into my practice in facility. But in facility acupuncture can be challenging because taking pets to a facility is stressful. So while driving around taking Cardiff to dog parks, I noticed mobile vets, mobile groomers, dog walking services that picked up lots of dogs. I'm like, I had an aha moment. I need to have my own mobile acupuncture practice. And so my lawyer boss helped me to incorporate myself as California Pet Acupuncture and Wellness. And I started doing house calls, acupuncture, herbs, Chinese medicine, food consultations. And that was great for a while, still working part-time, but I wanted to focus more on my own business. So I started building more clientele, adding more services, and eventually just made that transition to working just for myself. And that was 2008 that it all started, and things have progressed very nicely since then.
Perfect. That is quite a story. And well, you're also, one of the things you mentioned to me, you're also working with Pure Foods.
I am, yes. So I've always been really passionate about nutrition for myself. I grew up as like a slightly overweight child. I was a big tennis player and I needed to make myself healthier so I could be a tennis player in high school. So I changed my eating habits, lost a lot of weight, really focused on fitness. And I really feel like I've carried that into my adult years. I'm now 46 and I feel pretty much similar as to when I was in my 20s. And so every day I prioritize nutrition and exercise for myself and also advocate that for my patients and some of my clients too. So I've made homemade diets for my dog before. I've fed my dog other commercially available diets that are very similar. And Pure Dog Food was born in LA in 2011 by the co-founder, Lindsay Gores, the founder actually. And so I've known about the food for a long time and I've wanted to be involved with a company like that as more of like a ownership perspective and like chief veterinary officer perspective. So I had that opportunity at the end of 2019 so we can try to take the food to a different level. It's a cooked whole food product, mostly organic, nutritionally complete and balanced by a veterinary nutritionist, sold directly shipped to clients, but also sold at some higher end human food stores like Erewhon and Jade's Market and Co-Opportunity Market in Delhi in the LA area, and also a very nice pet store called Healthy Spot, beyond being shipped directly to clients. And soon we're going to have probably 2 or 3 cat foods as well. We've engaged a veterinary nutritionist to work on the formulation. So once things kind of settle down COVID-wise, we're going to focus more on that because right now things are crazy because people are buying huge volumes of food because they're afraid to go out. They're not buying as much from stores. They're really going for the online purchasing. So, and also as a food manufacturing facility, we have to practice some degree of social distancing so that employees can go to work at different times and still make food. So it's uncharted territory right now. It's very interesting to be involved with it. But I think it's really important that dogs and cats eat whole food diets and not processed food diets, or at least eat a partial whole food diet, because food just exists in a natural state. And then we as a society decided we want convenience and we want foods that are nutritionally complete and balanced, so that we don't have to like think about doing modifications to the diet ourselves. We can just choose a different food. So that really has driven a variety of health problems for dogs and cats, especially the problems with obesity. I mean, so many people overfeed their pets, and also overfeed their pets highly processed food. They're very calorically dense because they don't realize that the portion is way smaller than they think what looks appropriate for the pet. So my focus is to help to make pets healthier through whole food nutrition. Therefore, I'm very proud to be Chief Veterinary Officer and part owner of Pure.
Well, that is fantastic to hear. You know, there is so much that we're learning, continuing to learn as about our pets from a health and nutrition standpoint as we continue to grow. Honestly, there's been a shift between how we look and dive into our animals' nutrition and health long term. And I'm glad to hear that you're really working on a part of that. You know, one of the big things, and what our topic is here today, of course, that helps digest and pull all that food down and mash it all up, is the teeth in cats. So we got Scarfield's already up. Perfect. And so, you know, there teeth in cats. This is, of course, a huge topic, drastically huge topic that we could talk about probably for the next 3 days. But, you know, when you talk and work about just even, I want to hear your thought process about when you first meet a cat. How do you start to look at the teeth? How do you start looking at that as part of the whole of the animal?
Sure. I emphasize to clients that periodontal disease care is part of it should be a daily process. You should be doing something every day to help to promote your cat or dog's dental health, because the consequences are potentially irreversible, from tooth loss to cardiac disease to kidney and liver disease. Just the damage from bacteria and the inflammation that's created in the mouth can cause so many problems. So I really emphasize daily home dental care, and also try to educate them too. Like, a lot of people think that kibble-based diets clean pet teeth, but they actually don't, unless it's a specific veterinary prescription kibble that tends to maintain its integrity better. Because when the tooth penetrates your traditional kibble, it just shatters. So it doesn't really provide an abrasive effect. But if you have a veterinary veterinary prescription diet, which could even be given as a treat, doesn't have to be all that they eat. It maintains its integrity. And so when the tooth hits the kibble, it's softer and it has like a little bit of a flossing effect. So I'm okay with cats eating those diets on a part-time basis, just not full-time. So I really just try to focus on getting them to feed healthier foods, and also doing some kind of daily home dental care, from dental cleansing wipes to a toothbrush to some kind of combination to a water additive. I really advocate for anesthetic dentals as well on a regular basis, because that's the way that you can really fully assess the teeth. Take radiographs of the teeth, which are x-rays, scale under the gum line, extract teeth if needed, scale under the gum surface, which I just said. And really, like, if you have a trusted relationship with your veterinarian, I've never had patients have anesthetic problems when we go about doing things very step by step, like making sure they're the ideal anesthetic candidate. And right now, since I'm a mobile practitioner, I'm not doing dentals myself, but I have two excellent board certified veterinary dentists, a dog and cat dentist in Culver City, which is the neighborhood of Los Angeles, Doctors Anson Sugawa and Jenna Weiner. And they do the safest, most thorough dentals. I have had really old, really sick patients go under anesthesia, and they're awake and recovered and feel so much better within a couple of days, at least with their mouth, but they recover from the anesthesia so fast. And I just have a lot of confidence with their abilities to do this kind of procedure, even on a sicker, older pet. Like, so many people are afraid or say, my pet is too old to go under anesthesia for a dental. Your pet is never too old, but they certainly can be too unhealthy. So we want to have ideally always maintain a healthy state. Don't let them slide into that scale where their mouth stinks, they're having problems chewing on one side of their mouth, they have some kind of oral mass. Like, do daily home dental care so that you can help to prevent those problems. But don't be afraid of having your pet go under anesthesia. Just have that really collaborative relationship with your veterinarian, or ask for a referral to a veterinary dentist.
Absolutely. And, you said scale under the gum line twice on there. And I think you said that because it's super important. We're going to hit that.
The gum line is so important.
Can't forget it. Got to hit it twice because it is. It's like you mentioned, the dailies are so great at helping slow down the amount of anesthesia dentals that are required. But those can be such a huge opportunity for us to learn about the cat's teeth in a way that is impossible in kind of the house call, or kind of not even just the house call, the awake physical exam setting itself.
Or non-anesthetic dentals. I mean, some people really want a non-anesthetic dental as an alternative to an anesthetic dental because they're afraid of the anesthetic dental. And although there are some patients of mine that I can advocate for a non-anesthetic dental because maybe they are too unhealthy to go under anesthesia, and we just really want to try to get some of that dental calculus, some of that plaque, some of that tartar off the teeth. But when you do the non-anesthetic dental, you can't polish the teeth effectively. So it's basically just scraping. Yes, you're removing some of the calculus and tartar and plaque, but you're also creating grooves on the teeth. And so those grooves can, shortly after eating, hold food particles or allow bacteria to grow as compared to a polished tooth surface. And with the non-anesthetic dental, you can't scale into the gum line. It's almost impossible to get on the lingual side of the tooth, which is the tongue side. And I've seen pets have problems post non-anesthetic dental if it's not done in a judicious way. The stress it puts on them, the aerosolization of bacteria that ends up being inhaled or swallowed, that can cause respiratory problems or gut problems. So I really think I always advocate for the anesthetic dental if possible.
Well, that's we get so much information at that point in time, and they can, like you mentioned, age is not a disease. That's one of the things that we say a lot of times on here is age is not a disease, and you're absolutely right. That's why we going through an appropriate with a collaborative relationship to understand the risk factors through health is key. Now, you did mention a lot of different kind of daily preventatives through toothbrushing, through a lot of different things. Do you mind diving a little bit more into some of the daily preventatives, or kind of ones that you like or prefer?
I definitely feel like brushing is the best because brushing actually is going to help to remove food debris. And so kind of with the progression of dental disease, food gets on the teeth. Residues from carbohydrates, proteins, and fats. As far as I'm aware, carbohydrates are kind of the biggest culprit to promote bacterial growth. So then you get plaque, which is a film of bacteria that ends up on the tooth surface, which can be invisible or can kind of have a little bit of a yellow tint. And over time, that starts to mineralize and becomes tartar. So it's a thicker layer that still can be scraped off with your nail or with some kind of scaling device. And then it mineralizes, it becomes calculus, which is like this hard shell. I always think of my childhood eating ice cream and having magic shell, which is a liquid like chocolate sauce that hardens on the ice cream. And then you break it off and you reveal the ice cream, kind of like I can't remember the name. It's like a special dessert. You maybe get like an Asian restaurant or something, but it's like a fried ice cream with the shell on it. Anyway, maybe somebody can remember that and give us the suggestion. So the calculus is like that magic shell. You can actually crack it off and you see healthy teeth underneath. It should still be scaled off appropriately. But the brushing is going to help to prevent the plaque from accumulating and becoming tartar and becoming calculus. And the brushing also lets you get between the teeth as compared to, say, a dental cleansing wipe, which I feel like is a great starting off point. I love dental cleansing wipes. The top product that I use is made by Decra. It's called Denticetic wipes. I'm not sure if you're familiar with them. It's acetic acid, which is essentially vinegar, and a demineralizing agent called sodium hexametaphosphate. So that helps to take off some of the tartar and minerals. And so just as like an introduction, I think a dental wipe is great because most pets will let you put your finger in their mouth and rub their tooth and gum surface. And then maybe you can gradually work up to a brush. So brushing is best. A dental wipe is second best, I feel, because with a wipe, you also could put the wipe between your finger and use your nail to scrape away from the gum line. And you're leaving a little bit of the liquid on the tooth and gum surface to have that ongoing effect to kill bacteria and demineralize teeth. But sometimes brushing is intimidating to clients, and it can be really challenging just from a technical perspective. So finger brushes are another option where a brush slides over your finger like a thimble. I feel like the little dimples on that really are not as effective as an actual toothbrush bristle in terms of getting between the teeth and taking off tartar. I also feel like soft bristle brushes are better than hard bristle brushes, stiff bristle brushes, because most pets already have some degree of dental disease and gingivitis. And if you're brushing the tooth and gum surface with a stiff bristle brush, it's going to potentially create further gingivitis and bleeding, which most pets don't appreciate. If you could get your pet to floss, that'd be great. I have seen videos of some people getting their dogs and cats to floss. So that's certainly something if you want to dedicate your time to go to, just make sure, especially in the cat household, you throw that dental floss in a secure place away from where the cat can get to, because we don't want a linear foreign body to occur when the cat, like, who probably learns to love the dental floss, takes it out the trash and eats it, and then you're going to the emergency hospital for foreign body surgery at 3 a.m. That's never fun.
Yeah, that is certainly not where we want this to end up. We're here to help keep the teeth clean, help keep the teeth clean themselves. Now, what do you recommend for clients to? You mentioned kind of that grade up from the wipe into the brush itself. For those folks who've never done any sort of preventive care and are kind of a little worried about, or for those clients who haven't and are worried about kind of moving around that space, the cat-mouse space.
Oh, sure, yeah. And it would be good when you have that next wellness appointment with your veterinarian, which with cats should really happen every 6 months, if not sooner, if your cat has any kind of ailment or is on any medication that is used to sustain their quality of life. So use that opportunity with your veterinarian to ask for a demonstration as to how to clean your cat's teeth, so that they can educate you best. If your vet can't do it or doesn't have time, whatever, then maybe it could be a technician appointment. And that way you can, and ideally it would be good is if in the medical record it says every 6 months what the mouth looks like, and a grade is given too, or stage of what degree of periodontal disease is actually occurring. As far as I'm aware, there are 4 stages. I've seen some kind of grades where there's 5. So I kind of get a little confused between the differences between all the stages, because sometimes it's a little subtle. But ask your vet to help you in the process, and really get to know your vet very well. Ask to communicate with them via email beyond the office if you can't get office time. Now since veterinary medicine is changing due to COVID, people are doing more phone consultations as well. So if you have that existing patient, client, provider relationship, then your vet might be willing to engage with you on a FaceTime type basis.
Absolutely. Well, and there's a lot of really interesting things that we can do with dentals and dental health in this kind of telehealth, teleadvice space with your veterinarian as well. We have always thought of cat mouths as being something that is very chronic and very over time, but that always surprises clients. It always surprises clients when it's really bad. And when it's really bad, you mentioned some of the bad when it gets real bad. And so, why do we even care about this? Why do we care about this plaque being there?
Well, the effects of plaque are very negative, both in the mouth and systemically, meaning in the rest of the body. So when bacteria crosses from the gums into the bloodstream, which it could do if you have, say, an obvious opening to a blood vessel, which could be a tooth root, or there's some kind of damage to the gum surface, which could be gum inflammation or some kind of trauma that occurs, like the cat is chewing on something hard and it creates trauma to the gum and starts bleeding. The bacteria just gets right into the blood, and perhaps the lymph nodes in the neck and the jawline help to process some of it, but some of it could potentially move into the body and can end up on heart valves and can cause heart valves to thicken. And when a heart valve thickens, it could potentially contribute to or worsen a heart murmur, which can ultimately compromise cardiac function. And then even the kind of the streaming of bacteria into the heart can compromise the heart's ability to contract properly and lead to inflammation and or infection in the heart. Those bacteria can move into the kidneys, to the liver, to the pancreas, even potentially into the bones and joints, and cause problems in those organs, which are indirectly affected by the mouth. So if we keep the mouth clean, we're like shutting the window to the bacteria getting to the rest of the body and causing potentially irreversible damage.
And that's, it's something that I think a lot of people think about the bad of plaque in the mouth is tooth loss as kind of like the end all be all of tooth loss. But there is so much that goes on. The teeth also provide that lack of pain encourages eating as our pets get older, maintaining healthy weight and maintaining healthy weight and nutrition so that they can age appropriately. Besides just now, all of a sudden, we have this constant source of bacteria that's assaulting the body. That can be just so difficult, so difficult. Now,
there are times like people don't like the idea of their pet's teeth being extracted. Some people would be okay with their teeth just falling out, which is a horrible thing for them because it's uncomfortable all during that process. And then there's the bacteria getting in blood. But so many of my patients do better when they have any kind of more advanced periodontal disease and they have those teeth extracted. I have one very Insta-famous patient named Norbert the dog. Definitely everybody check him out on Instagram and social media. He's the cutest little rescue dog. He's a Chihuahua mix, and his tongue hangs out of his mouth because he doesn't have any teeth. And actually, hold on one second. I have a stuffed likeness of Norbert.
Get it out. I can't wait to see it. I cannot wait to see this.
This is Norbert the dog, this is the stuffed version of him. It's classic because I want to kind of keep him in his original state because this will be very valuable someday. I did have an open one, but I gave it to a former technician that I worked with. But Norbert's tongue hangs out because he has no teeth. And people don't like the idea of their pet's teeth being removed because they think of they kind of anthropomorphize it partially because you don't want to have your own teeth missing. But so many pets can chew just fine when they don't have teeth or have less teeth. And really, when you remove all the diseased teeth or all the teeth from the mouth, then it's just a matter of the mouth maintaining itself. I'm amazed at how healthy those mouths are that don't have teeth.
Well, and it is surprising. It is so surprising and so exciting to see an animal that has been so painful for so long be happy to eat again. In many ways, this changes this mode from there. Now, you mentioned about removing all the affected, removing all from the mouth. Why would we want to remove all of the teeth from the mouth?
Certainly if there's any kind of degree of chronic inflammation or infection. And one thing which cats especially get is stomatitis, which is essentially just inflammation of all the mouth tissues. And it's very uncomfortable. The gums get very swollen. It's hard for them to chew their food. They could end up losing weight and developing other health problems. So as far as I'm aware, with those patients, there's immunoglobulin treatment, which can potentially help, like an antibody treatment that could help to reduce some of that oral cavity inflammation. But I've seen plenty of times the recommendation from the veterinary dentist with whom I work is to just remove all those cat teeth because there's this kind of, as far as I'm aware, an immune-mediated type of process where something in the tooth itself, maybe you can elaborate on this for me, actually is contributing to the inflammation. So therefore you remove the teeth, you get rid of the source of inflammation, you get rid of the bacteria, and the mouth becomes much healthier.
And that's the best way to describe it right there. It basically is the cats start to have a little bit of that reaction. Well, I say a little bit, a lot of that reaction to the teeth and the roots themselves. And you mentioned you work with veterinary dentists. I think that veterinary dentists don't get enough praise for the work that they do. It is something that, even in the stomatitis world, you have to, when you want to remove all the teeth, you have to get all of the roots themselves. Absolutely, or else what you're doing isn't appropriate.
Right. X-ray, radiograph after you extract to make sure that all the tooth root is gone.
Yeah, and so we definitely, like you, we definitely recommend seeing a veterinary dentist for that. That is such an in-depth and intense procedure. But I'll let you.
I feel like the actual action of dentistry is so complicated, and most general practice veterinarians are not doing the whole thing themselves. A lot of times it's technicians that are doing most of the cleaning, and then the vet comes and oversees things. So I really feel like if you want to give your pet the best chance to have the best and safest dental, go the route of seeing a veterinary dental specialist. It will be more expensive. They probably don't offer a February pet dental health month discount, but it will be the most thorough job. And then you can really kind of start with a clean slate and focus on prevention from there.
Absolutely. Well, we talk about all these, and of course with veterinary dentistry, that has to be done in the clinic, has to have a lot of very specialized equipment to be completed. But you've had, over these last little bits, the ability to look at these cats' mouths in their own home. Many times when they're more relaxed, and I'd love to hear more about house calls. We start to look at different ways to do veterinary medicine, different ways to complete it, and your experience with those in-home exams as well.
I mean, I never thought I was going to be a house call veterinarian. It just never seemed like an option. I feel like I don't recall ever hearing about it in school. Everything was so traditional brick and mortar practice. And then I realized when I used to work with a veterinarian named Stephen Smith at the hospital that I first worked at in West Hollywood, which was called TLC Pet Medical Center. Now it's VCA TLC. And Dr. Smith left TLC to start his own house call practice. And I was like, I think I could do that as well. And then I wanted to really specialize it and have it be acupuncture and herbs and the holistic end. But I also knew I really needed that more traditional, conventional aspect as well to do diagnostics, to do vaccinations. I'm also a big believer in vaccine antibody titers to assess immunity as an alternative to potentially giving a booster vaccine when it may not be needed. So I really feel like there's such a need for that kind of practice, especially in Los Angeles, because it can be challenging to get around. You have clientele that are very busy and also often very affluent, depending on where they live and what they do. And there's a demand for these services. And so you have to kind of find where, like for me, my practice is very niche. I've created this practice as a personal veterinary practice where I'm coming to your home to figure out what is going on in your home with your pet, solve what we can, and what I can't do, I partner with area specialists so we can have a good collaborative approach to give the best care to the patient, because the best care isn't always something done at home. Sometimes it's in a facility, getting radiographs of the chest and abdomen, doing abdominal ultrasound, getting a CT scan, getting an MRI, getting an echocardiogram, having a surgery consultation, seeing a neurologist. Those things really need to be done in a facility. So I feel like I wanted to create this model of personal care where also, so I know I've gone through your pet's 10-year medical history and have created a summary which lives in my medical record. I have a 1 hour to 2 hour consultation with you where we talk about everything that's going on. I meet all the household helpers. We look through the house and the yard to look for possible places where your pet could be sickening or injuring himself. I create a post-consultation email summary that's like a report card. It's a very involved process. Like I basically, besides having a little personal time for myself, I live my life to help take care of my patients and clients, which I love. I like to give back, and that's the way I do. But cats especially, I feel like just benefit so much from having that house call approach because the stress is so much reduced. And certainly when it comes to the mouth, from an early on, from kittenhood, educating clients about dental care, starting the process of cleaning teeth during kittenhood so the kitten will be accepting of it and move into an adult cat that's accepting of it as well. I feel like with those patients that I have, when you really start that periodontal care earlier in life, it translates into better in life. And I just feel like house call practice is a great way to practice. Granted, I'm kind of always on call to a certain extent, but I do create structure where I tell my clients I turn my phone off at 10:30 at night and I turn it back on at 7:30 in the morning. And I have given them information as to where to seek care during that time. And on my voicemail, I have an outgoing voicemail that says where you should call, where you can go. So I can't do everything for everybody all the time, but I just feel like it's been such a great way to practice that I'm so much happier working for myself, even though I work every day, as compared to working in a practice where I have to endure the drama of working in a practice with other people. And also sometimes veterinary facilities are not very nice places. They're not like inspiring, light-filled, interestingly designed places. Some are, which is great, but the majority, I have to say, probably are not. And it can be kind of not so pleasant when you don't see natural light all day.
Absolutely. Well, with all of this time, we also, in this current time, how has that changed how you approach with COVID and all of these extra precautions?
Yeah, I've actually written about this for DVM 360, just how I practice in the times of COVID, because basically every time I go to a house call, I'm putting myself at risk to be exposed. What if my client doesn't know they're sick? What if people in their household are sick and they're not telling me that they are and it's just lingering in the air? So I use my personal protective equipment, as I always have taken safety precautions going to clients' homes with cleanliness. I'm now wearing my face mask, my goggles sometimes, most of the time, my gloves, some foot covers as well, wash my hands frequently, sanitize my equipment. So every house call is potentially an exposure, but at the same time, I have a very open stream of dialogue with my clients. And I have had clients tell me, I'm not feeling well, you shouldn't come. Somebody in my household may have been exposed, you shouldn't come. So they're always very forthcoming in that way. Good. And sometimes instead of seeing pets inside the home, I'm seeing them in driveways, on a front porch, in a backyard, in a garden, in a guest house. So there's a lot of ways we can go about doing it. And there are some clients that I'm not seeing at all right now because they're elderly or they're immunocompromised and they just don't want to have that risk, especially for wellness things. Like if your pet needs a follow-up Bordetella vaccination, you probably can put it off by a month or two because maybe your dog isn't even right now going to like the boarding facility or in-facility daycare or grooming or something. They're just staying at home with their owner. So so my practice really hasn't changed that much, just for being extra cautious and sometimes seeing patients outside. But I've been busier. I mean, I'm always busy, but I feel like I'm busier now than I was back in February. And people are still getting pets. People are around their pets more, so they're observing them and taking note of what maybe they weren't seeing before, or they're taking their dog for 6 walks a day, and suddenly like the patella luxation has finally created enough discomfort that they're showing clinical signs and they need to be examined. It's been a busy time.
Oh, good. Well, I'm glad to hear that. I'm glad to hear that you haven't seen too much of a drop in that. There is such a risk, and I know everyone was concerned about pets not having the care that they needed during this time.
Yes, or pets carrying COVID. What are your thoughts on that? You ready to talk about that one yet?
Oh my goodness, we're coming back this way, and of course, there have been some cats diagnosed with or shown to test positive with COVID, but none of them have ever been proven to be able to pass it on to humans. So that is something that we are not going to be concerned about at this point in time.
Yeah. Well, I think we should have concern, but have reasonable concern.
Yes.
As far as I'm aware, dogs lack the receptors like cats and people and other species, which permits them to be easily infected. But there was a case of a pug in North Carolina that lived in a multi-family household with multiple people who were sickened by COVID. And the dog started showing clinical signs and did test positive on a nasal PCR swab. It's unknown at this point if they did antibody testing on the dog's blood. So that dog was showing clinical signs, tested positive, technically was infected, but ultimately survived and wasn't deemed to be an infection resource to people. So I feel like if you feel like you're sick, don't hug and kiss and sneeze on your dog or cat, because you could potentially transmit not only COVID, but influenza to them or other diseases. So really socially distance from your pet if needed as well. A lot of my clients are concerned about, should I have my dog groomed by the mobile groomer or cat? And so I feel like that is actually a great time to not be exposed to pathogens that could be on your animal, because the shampooing and the rinsing is going to deactivate the virus and wash it off their body. As long as the groomer or whomever else is helping uses PPE, they're going to not likely put anything on your pet.
Absolutely. All right. Well, we have got a lot of questions that have been streaming up in our comments on there. Right. So if you are prepped, I'm going to start rapid fire. All right. So our first one is from Joanna Otten. Her big thing is she talks about how her cats don't mind their front teeth being brushed, but when she starts to move back towards those back teeth, back towards those molars, they won't let her get to their back teeth. Do you have any tips to make it easier to get all the way back into those?
If she's not already doing so, definitely try to make sure it's a positive reinforcement experience, where before you even start to work on your cat's teeth, if you're using a toothpaste, a lot of cats like the flavor of the toothpaste. You could put some of that on your finger. You could then, with your finger, get in the back of the mouth so they're used to the sensation of your finger and the positive reinforcement of the tasty toothpaste. Or you could use tuna water, chicken stock, beef broth, something like that, just to create a positive experience and gradually work up to the toothbrush thing going in the back of the mouth. Maybe the toothbrush isn't right for your cat right now. Maybe a finger brush is right. So you could put that toothpaste or whatever meaty deliciousness on your finger just to get them used to that action back there. And then you could eventually work up to a toothbrush. Okay.
All right. Perfect. All right. We've got another one that's kind of a little bit about some of these preventative things. This is one from Christine Vater. Now, you mentioned the water additive. Can you talk just a little bit more about water additives and what their purpose is and where they should be used?
I'm not the biggest fan of water additives, because I think it lulls people into a sensibility that that's going to prevent the problem. It can help to partially prevent, but it's not going to fully prevent. You really need to focus on abrasion from the toothbrush or a dental cleansing wipe. So I am pro some water additives. Like there's a product called TEEF, TEEF, which is it's actually, hold on one sec. I have it over here.
Oh my goodness.
This is actually the human version, but they make a powder that they add to food. I went to Super Zoo 2019. It was introduced to this product, and it's really interesting how it works. From what I understand, it's a blend of bacteria that help to competitively inhibit bad bacteria from setting up shop in your mouth. So it started as a human product to help older people in nursing homes and people who couldn't take care of the dental health just to have healthier mouths. And now it's translated into pets. So the pet version doesn't come like in a little mint tray. It comes as a powder that you add to water, and that can help to reduce the normal bacterial volumes in the mouth and therefore hopefully help to prevent pet dental disease from occurring. I help my own teeth right now while I'm at it. But other water additives, as long as your pet will tolerate the flavor and you don't rely on that as the only means, then I'm fine with. But I would ask your veterinarian for a recommendation for water additive.
And that's the thing. It is not the end all be all. It is certainly not the end all be all. It needs to be part of that conjunction, with your veterinarian to make sure you've got a great preventative care going on. Now, we have a question, kind of a statement, a little bit about from Moni Marie Chavez. She was really talking a lot about, I'm going to cover us all, so I'm going to take this back down, about how she brought baby dental toys and various dental toys or that are for cats. Are there any concerns with dental toys or things that you always talk to your clients about?
I think certainly there's concern for how hard those toys are and the degree to which your cat or dog is going to aggressively chew and damage their teeth. I don't really know that many cats to be aggressive chewers, but when you give a cat some kind of meaty bone, they certainly love it and go after it and will chew very aggressively, just like if they caught their own prey. So something that is kind of more natural could be an option too. Bones, we just have to be cautious with for a couple of reasons. The hardness of the bone could potentially damage teeth. A cooked bone is harder than a raw bone. So raw bone is softer, so you're going to have less of a potential to have trauma on the teeth. Raw bones, we have to be careful in case there's any kind of pathogenic bacteria, like Salmonella, Listeria, E. coli, or something that just grows because the bone is left out in an environment and organisms just grow. So you just have to be, there's so many different kind of layers we have to think about in that case. So if your cat is chewing on some kind of dental chew, the hardness of it is a little concerned, but then also with greenies, for example, can have an abrasive effect, or greenies or other similar starch-based chews, which are ingestible and digestible. They're very calorically dense, so I've seen plenty of pets put on weight as a result of eating too many of them, eating them too frequently. So we're going to have to balance that. Yes, you're giving your cat something that they're chewing on, but how many calories are you giving them to? Are you potentially contributing to them becoming overweight or obese? So I still think brushing and dental cleansing wipes are better than dental chews, but if that's the best thing you can have your cat chew on, then great.
Yeah, and and I hear this from clients all the time. I'm trying to find now. There's a wealth of comments on here, but one of our watchers, mentioned that they just could not. Their cat wouldn't let them look at its mouth at all. And that's I think that time. In those scenarios, how do you go about, what do you recommend in that stuff?
That's really tough. So I would say definitely talk to your veterinarian about what we could do in that regard. Maybe using a veterinary dental diet would be a good idea as a treat, because that larger, moister kibble maintains the integrity and they can actually chew on it. So perhaps not their everyday meal, but something that they would chew on, maybe a couple pieces on a day, depending on the caloric count and what your cat's needs are. Or perhaps they are chewing on some kind of dental device, dental treat beyond something like a veterinary dental diet.
Absolutely. My goodness, I've got so many to run through right now. I am so sorry. I found it a little overwhelmed. It was from Victoria Leverage. She's the one that's having a tough time getting her all the way into any way into her cat's
That cat, Victoria's cat, might need more frequent anesthetic dentals then, where the cat would be anesthetized for full evaluation and cleaning. If she can't get in there to do anything herself, and we can't say the cat won't accept one of the chews or it's not doing a good enough job, then I would definitely have that regular relationship with the veterinarian and potentially have more frequent anesthetic dentals.
Now, you did mention, on anesthetic dental is kind of the full workup beforehand. What does that generally look like to you? What do you look for when in a colleague or in a kind of a specialist when you have patients and you want to make sure that they have that kind of best as possible gold standard run up?
So certainly I prepare them as best as I can for the process. On a house call basis, I can do blood, sometimes do urine and fecal testing. Urine, I will do urine analysis is important, especially for an older cats, because the urine tells us a lot about how the kidneys are functioning. A lot of cats, as they age, develop some degree of chronic kidney disease or CKD, and that could compromise their ability to safely go under anesthesia or have other procedures done. So we want to do pre-anesthetic blood work, ideally also urine testing, just so we can make sure the urine is concentrated appropriately. There's no presence of protein, glucose, ketones, crystals, bacteria, et cetera, in the urine. If I have a patient that I hear a heart murmur on, I recommend that they have a cardiology consult before they go under anesthesia. Many patients with heart murmurs can safely go under anesthesia, but it's always good to have that clearance from the veterinary cardiologist before your pet is on the table having the dental and potentially has a heart problem. And then I feel so comfortable. Some older pets also should have x-rays of their chest and possibly their abdomen and possibly an abdominal ultrasound before going under anesthesia for dental, just to make sure there's nothing lingering in those places that potentially could compromise their health and ability to safely have an anesthetic dental.
Absolutely. And, that's when you mention a full workup, that is the full workup that you can get. We will have every information about your pet as possible from there.
And there's some practices, like especially corporate practices, are a little more prone to having packages of wellness that would be really beneficial from your pet, from blood, urine, fecal testing, blood pressure checks, x-rays, ultrasound, even like dentals are sometimes part of the package. So I would really consider that, because it's very much a cost saving, and you can really, the best medicine is when you're doing your diagnostic testing. So you're making sure there isn't a problem, ruling problems in, ruling problems out. So if your veterinary hospital offers that kind of package, go for it, because you're going to get a lot of bang for your buck.
Absolutely. That is, like I said, that is a huge boon to whenever we can get those done and really learn more about them. Now, I'm jumping back to dental toys, jumping back to, or rather, chews on there. One of the things that was mentioned and has been asked by a couple of people to kind of follow up on was from Tracy. She talks about using the dried silver vine, dried stems from catnips on there to chew and help that abrasiveness from there. I was kind of curious, besides just there for the abrasiveness, how do you feel about catnip itself and how to approach that?
Thank you, Tracy. This is really interesting. I've never learned about this before, and I'm going to research it some more. So cats, when they eat grass, for example, that can have an abrasive effect, especially if the grass kind of gums up into a ball, and that could help clean the teeth. So I could see with fresh or dried catnip, that could possibly have an abrasive effect too, as long as it's not too hard that's irritating the teeth. What was the rest of her question again?
Oh, the rest of it was actually more of my question on there. It was about catnip. How do you feel?
Catnip. I am very pro catnip. I think cats have a great time on catnip, provided they're not like running around the house crazy and hurting themselves. It really seems to chill them out some. I've also seen cats show more interest in their scratching posts when the scratching post, either vertical or horizontal, has been rubbed with catnip. So I'm very pro catnip. Yes.
Perfect. There's a lot of, there's a lot of uses besides just the dental on there. I think you say the catnip, it does provide a lot of, when it moves into the scratching post, that encouragement and that activity to help them run and move around a little bit.
And not only just like scratching where we want them to, but like engaging their muscles, engaging their latissimus muscles, promoting them to scratch a little bit higher, maybe even making them climb up. So as obesity and dental disease are the number 1 and 2 diseases that we veterinarians see in cats, it's really important to engage your cat in activity.
Now, I'm making lots of hard segues here. We're going left and right. But something that we talked a little bit about COVID earlier, but there's some missions that are going on during these times to make sure that people have appropriate care for their animals. That was, like I said, one of our huge concerns. And so you are involved in one that's coming up soon, right?
Yes, it's actually launching on Tuesday. The whole process is starting now. It's called the Pets in Need Project. If you want to learn about it, it's Well, let me back up first. So the whole concept was created by Elvet Sciences CEO, Christian Kager. Hoping I'm pronouncing his name right. It's a little complicated spelling. So Christian is a philanthropist, and his company, Elvet, is a Maine-based company that makes the highest quality CBD products for pets. Mm-hmm. They actually are doing the majority, if not all, the research on the actual uses of CBD in pets when it comes to treating arthritis, epilepsy, and other seizure disorders, issues with chronic pain, atopic dermatitis, behavior, cancer, helping to support the endocannabinoid system so that the patient feels better in the processes and healthier. These are not products that are meant to specifically treat conditions because they are supplements as compared to medications, but they can help to support the health of the body to especially help provide a pain relieving or calming effect or a better sense of well-being. So Elvet Science is leading the charge in research and also now philanthropy by bringing me in to help with this Pets in Need project. So we have a huge homeless problem in Los Angeles and also in California in general. In part, it's very nice to live here, just weather-wise. It's also very expensive to live here. So rent is expensive, home ownership is expensive. People lose jobs all the time. COVID has affected the whole economy and the way people are going about lives. So people are really struggling. So Elvet wants to give back to communities. So there is the Ella Van, which is going to these communities in San Diego area and Los Angeles area and San Francisco area to provide free veterinary services to people in need. So that project is launching on Tuesday in San Diego. I'm not personally going to be in the Ella Van because I have responsibility to my clients and patients, and I just can't expose myself potentially. I have too much that I need to handle, but I am helping them from a media perspective and also engaging celebrities and influencers to help to tell the stories of their pets and what they mean to them and where the pets came from, because people are relying on their pets more than ever to provide emotional support. So I'm very proud to be part of this project, and I encourage people to follow. The main landing page is elvetsciences.com/pets in need. You can Google it and find it really easily. Also follow Elvet Sciences on Instagram and Facebook, and me, Patrick Mahaney. It's just my first and last name.com, and you'll learn about it. Help to support us, spread the word. If there's an influencer out there that wants to help promote us, we can make it beneficial to you. So give us some of your time, and well, we can work together. There you go. Thank you.
There we go. Right here. Yes, elvetsciences.com/pets in need on there. So either use that or Google on from there. This is, like I say, nice way to be. It's such a great mission, and they do such a great job with their research and continuing to push and drive understanding of that entire system forward itself.
It's a wild, wild west out there. Everybody hears about the benefits CBD can have for animals, but there's not a lot of awareness to actually how to go about doing it and doing it safely and effectively. So we need data from studies that shows that this dose does this to the pet, both good and bad, because everything can have a side effect, even something natural. Just because it's natural doesn't mean it's safe. I mean, like, toxic mushrooms are natural, but they're not necessarily safe. Blue-green algae is natural, but it's going to destroy your dog or cat's liver. So natural doesn't always mean safe. So we really need to have research behind the use of these products so that we veterinarians can best advise our clients how to safely use them for their pets.
Absolutely. Well, that is, I'd like to say, I'm so excited. Now, we have a couple people who hopped in a little bit later. That have a couple questions. I want you to just quickly hit this one question for me right here at the end. How often do you brush your cat's teeth? Is daily ideal?
Steckler A. Oddity, that's a great question. I advocate for daily home dental care. Think of it like your own mouth. You brush your teeth hopefully twice a day, morning, evening, maybe after each meal if you're like the best student that your dentist has ever created. So think of it as a daily dedication to your pet's overall health and wellness. Keep your pet's toothbrush or dental wipes or whatever you're doing by your own toothbrush, so that at the end of the evening, when everybody's kind of calmer in general, you can work on your pet's mouth and hope to keep their teeth a better place. So try to dedicate to daily home dental care.
Absolutely. And I know we're just bouncing back and forth. Now we have a couple questions about the van, and you said that's going to be in the San Diego area. Is that
Starting
right?
off on Tuesday, yes, and multiple occasions there.
Okay, perfect. Do you know if there's any plans to move out of that area? Samantha was asking about that.
Yes, definitely. So San Diego for the first couple of days, and then it's like a week in each city, basically. So this coming week in San Diego, the week after in the Los Angeles area, the week after in the San Francisco area.
Okay, perfect. All right. We've got time for. I'm gonna give Steckler one more follow up, and then I'm go from there. We've got Steckler has the 3 cats. This is actually a great question.
That is a great
question. Brushes per cat.
That probably would be best because all cats' mouths are different. You could have one cat with very advanced dental disease and one kitten with no dental disease or very minimal dental disease. So I would definitely have separate toothbrushes or do a very thorough cleaning in between. Perhaps dipping the toothbrush in peroxide or something like that, cleaning with alcohol, putting in the microwave for a couple seconds, or putting in your dishwasher. Those could be ways that you could clean it if you only had one brush and you wanted to share it amongst cats. But I think that a separate brush is a great idea because you wouldn't want to take that like filthy mouth, lots of bacteria getting into your other healthy cat's mouths. Because like all sorts of bacteria can end up growing in the mouth. Sometimes I've seen cultures of mouths and I'm amazed at like E. coli bacteria growing in there, or methicillin-resistant Staphylococcus aureus, aka MRSA. So we really want to prioritize safety and cleanliness in your cat's mouth. So separate brushes sound great.
Absolutely, and just like ourselves, you wouldn't want to use your friend's brush.
Unless you had no other option.
Or your partner's brush right there from itself. So certainly
hopefully your partner is keeping his or her mouth as clean as yours, and you'd be a little safer.
Perfect. Well, we are coming up kind of right there near the end of our time, but I always, we've covered so much today. Is there, I'd like to give you a little bit of floor. Is there anything that we didn't cover today that you want to share with us?
There's been so many things that we did cover.
I know.
I just think it's people so seem to disregard periodontal disease in pets because it can be an invisible disease until we see a problem. Your cat is suddenly chewing on the opposite side of the mouth. They're drooling. They have horrible breath. They're not eating at all. And by that point, disease has really progressed to the degree that a lot of work and money has to be put into trying to fix the problem. So prevention really is the best medicine. If you focus on trying to have your pet live the healthiest life from a get-go, maintaining a slim body condition, keeping their mouth clean, preventing trauma, toxicity, they're going to be healthier throughout their lives. So really focus on that daily home dental care and having that very open relationship with your veterinarian where you can figure out the best plan for your cat's needs.
Mm-hmm. Absolutely. And thank you so much for all of your time and all of the wisdom that we have on here.
Thank you, Scarfield.
Scarfield, he has been such a great participant today, showing off those chompers at every single opportunity there.
Special guest.
I know we're gonna need to get one for ours as well. So again, thank you so much, folks. This will be on YouTube as well. And join us. We've got another webinar. We've got Cats and Coffee again this next Wednesday, and then a webinar. Our next webinar is going to be on May 30th. Taking a little bit of a break there from that standpoint, but God, I just can't thank you enough. We would love to have you back once this van starts to roll around a little bit more for an update on there, just to hear about what's going on and everyone that's being helped in need. If you're okay with that.
Oh yeah, and we have a professional film crew that I know because back in 2014 when Cardiff was in his first throes of lymphoma, I was contacted by the Canine Lymphoma Education Awareness and Research Society, or CLEAR, and they were filming a documentary called My Friend Changing the Journey, which profiled families going through cancer journeys with their pets. So my husband Phil and I were featured on it with Cardiff, and so I got to know the film crew well. So we have a film crew going in all the destinations to document the process. So it'll be shared on our social media, on YouTube. Everything is already in process right now. It's all happening very quickly, but we're going to do our best to help all the pets that we can within reasonable limits in these communities, because certainly people are struggling right now, and we need a way to help both pets and their people.
Absolutely. Well, I'm going to drop up a couple of things. Your Instagram right up here.
Yes.
Instagram is Patrick Mahaney, and then the website itself also patrickmahaney.com. Thank you so much for your time. Stay safe out there. I know you COVID. And everyone else, y'all stay safe as well and have a great weekend.